Hey guys, so my name is Rabia. I'm one of the junior doctors in the NHS and I came to UK about 2 years ago. So I wanted to start my first video with 10 tips that you can use on your first day on your NHS job. On your first day, it can be very daunting because you're in a new system altogether and there's so much happening all around. So the first thing that I would suggest you do is to be a sponge. Literally just absorb your surroundings. This is, in my opinion, the best way to really try to understand the system. So, observation skills really do help, and don't wait for someone to tell you something. You can literally just shadow people, see what they're doing, how they're doing it, what their work ethic is, how professional they are, little things on how they talk to other members of the teams, especially nursing staff. So just absorb everything that's going around. So the second thing that you need to do is you need to ask questions. If you don't understand something, if there's any confusion, or if you think that a certain procedure is being done a certain way that you're not used to, ask questions. Ask the nursing staff, ask the OT and PT teams, for example, things like different terms that they use for discharge planning. So make sure you ask a lot of questions because that is really going to build your knowledge and it's going to help you settle in quicker. Number 3, very important. Tell everybody that you're new, especially if you're shadowing. So obviously you should ask for a shadowing period. Ideally it should be 4 to 6 weeks. And whatever you're not comfortable with doing, just let people know and tell everybody that you're new. So nursing staff, ward clerks, physiotherapists, any of the wider teams, just let everybody know that you're new and tell them what you're comfortable with and what you're not comfortable with doing. Tell them you're still shadowing so they could maybe ask someone else to do that job. Number 4, learn to document. Documentation forms a very big part of our job in the NHS. Everything that needs to be documented can include your conversations with other teams, for example, referrals, families of patients, whatever conversations you've had with them, any sort of conversations with the patients, if they're refusing treatments or if you've assessed capacity, you want to, any changes in the management, just document it all. And apart from that, obviously your daily ward round reviews, make sure you document that you've seen the patient, because if you miss the documentation, then they think that you haven't seen the patient, and nurses usually get a plan from your documentation. In this system, if you haven't documented it, it's automatically assumed that it's not been done. Practice procedures. This is very important. So make sure you get as much practice during your shadowing period as you can, because once you're doing everything on your own, you need to be more confident. So this is your window to actually practice more and get better at these skills. So look at the different kinds of needles, look at the different types of methods of taking bloods, for example, or catheterization or any procedures. It's very important that you practice, because once you have to do it, it is less daunting. Find out where you can find your trust guidelines. Some trusts have apps, some trusts have intranet, some trusts have websites. So you really need to find out where everything is for your hospital, because the management of your patient will be based on these trust guidelines strictly. So anything from electrolyte disbalance to managing AKI, antibiotics, drug levels, so all of that is going to be on trust guidelines. So make sure you find out where they are and then make sure you follow those religiously. Use the important apps that will help you in your day-to-day NHS life or your NHS career. So the main app that I would suggest would be the ATSP app. For Apple users, it's in a file format. So if you just Google ATSP app, and you're going to get the link and you're going to get it. So that basically has all the scenarios, well, most of the scenarios that you're going to come across, and it has basically giving you a guideline of how to manage those situations. It also has common doses of medications that you can prescribe. So that is also a very handy app. I'll do a separate video on the common apps that you can use and what is really beneficial, but make sure you have the BNF app on your phone as well, and induction can help you find out numbers for everybody. Learn the ABCD approach like the back of your hand. Honestly, the ABCD approach is your savior in any kind of emergency. So every time you're called to see an acutely unwell patient, you need to go in a systematic way. Use the ABCD approach to examine the patient, to formulate a plan. So it is very important that you know that, because I remember I froze when I had to see my first acutely unwell patient, and there was an emergency buzzer that was pulled, and I just couldn't really, I just completely froze, and then my consultant and my registrar came. So, it's very, very important to develop the habit of going in a systematic way, step by step. That really helps to manage the situation, and also really helps to keep you calm as well. The most important, be honest. Recognize your competence limits, which means recognize what are the jobs that you can't do because you don't have experience, or you're not comfortable, or you don't have the skills. So, for example, I can't do an ultrasound guided cannula, I'm not going to attempt it. So there's no one who is going to judge you if you say that you can't do something because you don't have the skills for it, or because you're not comfortable doing it, or you haven't done it before. So be very honest and be truthful. Secondly, do not lie. Do not lie in handovers, do not lie to the patients, do not lie in your documentation. It is very, very important that you remain honest. That's one of the core values you need to instill in yourself. You really need to be honest, especially with the patients. If you've made a mistake, you need to go and admit it in front of them, apologize. There's a whole procedure for all of that. It's called duty of candor. But just make sure that you stay honest in your work. It is very, very important. Go easy on yourself. I really want to highlight that this is going to be the toughest time of your NHS career, because you've come to a new country, you're working in a new healthcare system, you're working in a place where there are so many new things, and the best way to put it is, I heard someone say this, and honestly I think this is the best description: you don't know what you don't even know yet. So it really helps to be kinder to yourself and take it slow, because if you set high expectations for yourself, it's just going to add to your stress. So take it slow, give yourself time. It took me 3 to 4 months to really understand the system. So just give yourself time to adjust.